some of the signs of skin cancer that people mightn't be aware of or ignore are probably simple things. So probably the most common thing I'll see for people coming in with something called a basal cell carcinoma in particular is for them to say that they've got a pimple that won't go away or a sore that won't heal. And something I like to tell those people, particularly if they're high risk, is that if you find yourself looking at the same pimple or the same sore on your skin for a period of more than a month or two, and it's probably a really good idea to get it checked out, because that's a really common way for us to find one of the most common types of skin cancer, a basal cell carcinoma. So that's one that people overlook probably commonly, and means that things are picked up a little bit later than they should be. And probably the other one is just new spots on skin. So particularly younger people, as we develop more freckles, more spots, that sort of thing, people can start to become less interested when there's something that's new. But if you do get something that's new and doesn't look like the other things on your skin, then it's a really good idea for us to have a look at it. Those would probably be the two main ones. Similarly to sort of sores that won't go away or pimples that won't heal, sort of if you're someone who has sort of dry skin or those sort of things, the same sort of thing holds. Like if you find yourself looking at the same individual spot that doesn't look like it wants to heal over a few weeks or a month or two, then that's a good reason to have it checked, because a lot of our common non-melanoma skin cancers, they aren't things that develop within moles. They're something that they don't have pigment. They're not a brown spot on the skin. They're more commonly something that's sort of red or pink or scaly or perhaps even bleeding. And so little areas like that don't settle down are things to keep an eye on as well. I like to tell people that every melanoma that's diagnosed, it starts as one single cell. So no one can see one single cell. That's extremely difficult to do, but our job as skin cancer doctors is to try and pick up something when it's as small as possible. So if you're an adult and you're over the age of 40, if you develop a new spot on your skin that doesn't look like a freckle, it doesn't look like the other spots that you've got on your skin, it's a really good idea to have it checked out. Because if we can find that melanoma when it's 1 or 2 millimeters instead of when it's sort of 10 or 20 millimeters, with melanoma in particular, that can mean the difference between something that's nice and thin and easy to deal with and something that's invasive and can potentially be life-threatening. So those little tiny spots on the skin that are new, particularly as an adult, are worthwhile having a look at. And it doesn't mean that every new spot that shows up on your skin is nasty. It's just that if we can pick up those things when they're small, have a look at them then and reassure you, or if it is something nasty, get rid of it then, and we're saving ourselves a lot more sort of costs and complications in the long run. So if you're an adult and you develop a new spot that doesn't look like anything else, it's a good idea for you to come and say hello, and we'll have a look at it from there.